Welcome to the Dental Journeys podcast, proudly sponsored by Whitecoat Financial. Join us as we explore the journeys, strategies, and successes of dental professionals across Canada. Whether you're a brand new grad or a seasoned dentist, our episodes aim to provide advice and insights for your journey in the dynamic world of dentistry. On today's episode, we're thrilled to welcome Dr. Ashley Gill, a pediatric dentist in Toronto, Ontario. Dr. Gill attended the University of British Columbia, where she completed her undergrad and dental training. She then went on to pursue a general practice residency at Bronx Lebanon Hospital in New York. Dr. Gill then completed her specialty training and earned a Master's of Science in Dentistry at the University of Washington and Seattle Children's Hospital. Lastly, Dr. Gill was awarded a fellowship with the Royal College of Dentists of Canada, and she's a member of both the Canadian and American Academy of Pediatric Dentistry. If you'd like to connect with Dr. Gill, we've included her social media links in the caption of this episode. So without further ado, let's dive into our conversation. Before you started practicing, if you could give me just a brief intro to where you grew up and your background growing up here in BC.
Yeah, so I grew up on a blueberry farm and I spent most of my younger years there. And it was really nice. I mean, it was nice to have a place like it's huge space in nature and to have like friends and family and cousins and, visit and things like that and play as kids should. But beyond that, like growing up on the farm for me was really inspirational to see my dad actually like in that environment and in a field that it's really uncharted territory coming from India and running a business like that. And so it was really cool to me always and fascinating to see him running an operation with dozens of employees and having hundreds of pickers and even understanding the biochemistry of how do plants grow and how to make them grow faster and the machinery and all of that. And so I think for me, those were really formative years because it really showed my dad in a role that, gave me the concept of limitless potential, and that kind of harnessed my motivation in later years when I began to kind of explore my career and things like that.
Did you have to work a lot on the farm growing up or no?
Thankfully, no.
Okay, I'm surprised. Yeah.
Not so much. My brother did, but not so much.
Fair enough. And then I guess working on a blueberry farm, did your parents ever tell you that, hey, this is what you're going to do in the future? Because I know most farming families, It is very much, it stays within the family. But then you ventured off and gone into dentistry. Was that something that you knew was always going to happen? Or was there an idea of, I will work on this farm?
I think it was different because there was three of us. It was different because my brother and sister naturally had their own careers and they kind of fell into the family business and things like that. Whereas because I'm much younger than my siblings. And so it was different for me because they kind of my family kind of made it a priority for me to explore that avenue. And so it happened organically because, they were there basically to fill that role.
Ah, got it. Okay. So it's sort of like big sis and big brother were going to take over the farm. And how big is that age gap between you guys?
So my sister's 10 years older than me and my brother was 7 years older than me.
Okay, got it. So it's sort of like the baby in the family gets to go to school and we're all going to take over the farm.
Yeah, exactly. Yeah, very much. Yeah.
So that's awesome. And then I guess obviously you finished high school and then went straight to UBC. How was your experience at UBC? And then what made you actually stay at UBC to complete dentistry school? Was there an idea to, maybe go U of T or a different province? Or was it just an idea of, I want to stay close to home, I want to go to UBC? Or is that just where you got in?
Yeah, essentially that. Like I had considered going to schools in the East Coast quite a bit, but UBC was sort of an obvious decision for me because I was able to maintain the comfort of having the community that I grew up with really close by. So that was really important to me. And I knew that they were going to be tough years. And so I wanted to make sure that I had that support system around me. So for me, UBC was a decision mostly just, for that reason.
Okay, fair enough. And then I guess this sort of is going to lead into the rest of our conversation, but what made you choose dentistry? Did you know from maybe a young age that you were going to go into this field, or was it sort of after undergrad when you decided that this is the field you wanted to go into?
I actually decided on dentistry really young. Like it was in kind of high school, I think maybe grade 10 or 11, I decided on dentistry. And it was from sort of observing and shadowing my dentist as well and understanding that dentistry has the ability to kind of incorporate healthcare and business. And I was also intrigued by seeing that it was a very flexible field. Like you're able to hone your practice based on your skill set or just what you enjoy doing. And, it could be holistic dentistry, it could be cosmetic dentistry. For me, it was pediatric dentistry. So I really like the aspect that you have that autonomy to choose your specifically your own practice philosophy and how you wish to manage patients. So for me, that was a huge selling point.
Interesting. Did you have people in your family who were dentists, or did you just shadow your own dentist and other dentists in the community? Like, what made you actually choose on that?
Yeah, no one in my family is a dentist. Just from watching my own dentist, really.
Okay, so you guys had a close enough relationship where you just sort of shadowed in high school and undergrad?
Yeah, we had been with it. We've been with that office for 35 plus years, and so a really close relationship with my dentist.
Yeah, that's actually wonderful where you can have that relationship. I find that I've had a few guests on the podcast where they've actually said that it was because of their dentist that they became a dentist. But
Yeah.
I think you're one of the only ones who said you just watched what they did and really enjoyed it. A lot of them had their own, oral health issues, and they're like, all right, this person really helps me. I want to be able to help other people who, sort of had the same situation as me. But it's really cool that you were just able to shadow, you saw this person's life and you're like, all right, this is what I want to do.
Yeah, for sure. No, it's inspirational. And it's also cool to think of too that now you're in the field and you can be that for somebody else too.
Yeah, absolutely. And then did you know that you wanted to specialize right away, or was that something that came about as you were in dentistry school?
I'd say that the decision kind of happened gradually. Before dental school, I had done a lot of work with children with special needs, and that was a big part of my volunteering years and things like that. So once I had started dental school, I knew that I kind of wanted to incorporate that somehow into dentistry. And I came to learn in dental school that, pediatric dentistry is where you really learn the skills to be able to deal with children with special needs. And that was an aspect that I really wanted to do. And that kind of guided me, as well as just, of course, just being able to work with kids and being able to be silly and fun, and it's lighthearted. It's a high energy field. And that kind of suited my personality more so than general dentistry.
Fair enough. Yeah, that's cool that you got to sort of blend an old passion and then sort of bring that into the future with your current career now.
Yeah, definitely.
And then where did you complete residency, or better yet, because I know you went to New York, but
Yeah.
how did you end up there? Like, logistically speaking, is that just where you got in again, or was that intentional of I want to go live in the Big Apple and practice there?
Yeah, it was very intentional. so, so after dental school, I really knew that I wanted to bit more exposure to working in a hospital setting with medically compromised patients, being on call, treating children. And that was going to be my year to sort of really confirm whether or not pediatric dentistry was a right fit for me from a logistical perspective. And I knew it'd be a bonus. I could have gone anywhere, but I knew it'd be a bonus to be in New York and live and experience a new area, since I'd only really lived in Vancouver prior to that. So it was intentional, and I'm really, really glad to do it.
How was the experience outside of dentistry? Because this is your first time living outside of, your home, and I would assume your family's very tight knit. So what was that experience like, moving away, having this probably crazy schedule, learning a lot, but also enjoying the social aspect of living in New York? How was that for you?
It was pretty seamless, honestly, because when you're going into a residency program, we were with 35 other residents, and everyone's really in the same boat. Everyone's leaving home, or for the most part. And so you're instantly going into another community, and because everyone's kind of at the same stage of their lives, you really bond over that. And, those became, and still are, actually some of my closest friends, and you get exploring the city together. And of course, I had lots of family and friends visiting me all the time because it's New York. So it was really nice, actually, and quite easy to do.
Yeah, fair enough. And now that you live in Toronto, would you say Toronto is like the mini version of New York, or is it just a completely different vibe?
No, very much. Yeah, I'd say Toronto is, just because of diversity too, right? So I'd say that, Toronto has that aspect of diversity that New York is so, famous for, essentially, and having so many different cultures and restaurants and food and things like that. And that was a big aspect for me in deciding to be in Toronto.
Yeah, no, that's great. And I guess while you were doing your residency, were you applying actively to, schools where you could complete your specialization? And then if so, what made you choose University of Washington? Because I know that program is very difficult, and correct me if I'm wrong, it's one of the top schools in North America. So what was that process like? What did you have to do to your application to make it very appealing? And maybe if you could tell me about your experience while you were there. What was the education like? What was the workload like?
Yeah. I had applied to programs in New York, sort of, geographically it made sense since I was already there. And then UW was definitely the top of my list. And then just to kind of make sure that I had the best chance of getting in. I also applied to several programs within the other states as well. But University of Washington was really one of my top programs because it had a really great blend of didactics and clinical dentistry. Whereas, and that being because it was associated with the university and a hospital setting as well. So we really got a good comprehensive education. Whereas some of the programs in some of the more just purely hospital-based programs, you don't get that sort of didactic training that you get from being as part of a university. And so that was a really big factor for me. And then also, of course, just being geographically only in Seattle, 2 hours from driving from home was a major selling point as well. I truly was really honored actually to even be offered an interview and to be able to get through the interview process and then to be accepted, because it is a really tough program to get into. And naturally, there's only 2 programs in all of Washington, whereas New York City alone probably has over 10 programs. And so you just have so many more people that are competing for fewer spots. And I was really honored to be accepted.
But while you were there, did you find that because it was so difficult to get into, you got to sort of rub shoulders with, some of the more promising dentists that are coming up in the industry? And even today, are you guys still close from that program because you guys were all sort of competing? You're all sort of the top of the game. How was that? Was it competitive, or was it a better atmosphere of all of you were actually in the same boat and you got along?
There was absolutely no competition at all, actually. At that stage in everyone's career, it was very collegial, and even with our professors and things like that. Like the part that's great about the University of Washington or any real sort of more prominent program is the fact that your professors and your educators are of that, standard of excellence. And so you have a lot of research coming out of the university, and you're learning from these really great minds. And I think that we all felt very fortunate for that. And still, beyond even my co-residents, I'm still close with many of my professors too. And, we chat regularly, and I've learned a lot from them, and they're some of my biggest mentors to this day. As far as co-residents, yes, it's definitely some of my closest friends today are my co-residents. Yeah, you go through a really tough time where your life is on pause for those 2 or 3 years, and so it's really just you have each other and you commiserate together and you enjoy the happy times together and you support each other, and so it's a really unique experience to go through. And I think that it's like trauma bonding, right? Like you really develop a close relationship because you go through tough times together.
Yeah, I think there's something to be said about studying very late night with someone and stressing frantically over an exam that's in like 2 hours and you feel like you know nothing about. There's something about that moment of like looking at the other person in the eye and being like, okay, at least we're in this together.
Right, exactly. Yeah, there's so much support and strength through that.
Yeah, I actually grew up like playing soccer, and it's funny, my roommate in university was the other goalkeeper. So we were both competing for the same spot, and we hated each other for the first, 4 or 5 months. But then afterwards, we were just bonding because we were both going through the same struggles and everything. So I completely understand that it's almost like a team, honestly. All of you are there together. You all have this one goal, and everyone's going through the struggle together. And you get some of your best relationships from those university years.
Yeah, definitely. And for the rest of the two, right? Like there's a reason why, we have our childhood friends, we've bonded during a certain aspect of our lives. And then, this is another aspect of your life that is pretty intense, right? So I think that anything that's more sort of transformative years, you're always going to develop close relationships from those.
Yeah, 100%. And plus they're sort of, they've known you from the start. And there's this sense of comfort as you get older where you don't have to talk every day. And it's just, it's like you picked up where you left off. And I guess speaking about your time at U of W, you had your thesis published in the Journal of Pediatric Dentistry. What was that like? Like, was that a goal of yours, or was that something that, you were lucky enough that just sort of happened?
I never really had it as a goal to publish at all, let alone the Journal of Pediatric Dentistry. But I was lucky to have a really incredible mentor in residency who really encouraged me to pursue it. And, even if it were just for a learning experience, to go through those steps. She's like, you know what, you don't know, this might be, maybe it won't work this time, maybe you'll do it another time. And so I kind of approached it from that perspective. And like my study specifically was on the aesthetic treatment of baby teeth, specifically white crowns. And at that time, there was sort of a shift in pediatric dentistry towards more contemporary concepts. Before pediatric dentistry hadn't changed a whole lot. There wasn't a whole lot of progression in the field. And so it was a really kind of exciting time. And now residency programs are starting to kind of learn and teach the residents more about, aesthetics does matter in pediatric dentistry. It's not just about adult dentistry. And so it's been interesting because I've had, current residents who've, even through social media, have reached out to me to ask questions and learn more. And it's really opened up, I think, a lot of opportunities for me professionally.
Yeah, that was actually going to be my next question. Is obviously this, I would argue, and correct me if I'm wrong here as well, is this is the leading journal in the field. And so did it fuel further career opportunities, or honestly, even just like connections and networking opportunities with people outside of pediatric dentistry?
Yeah, definitely. So when you publish with a journal like that, you get a lot of speaking engagements and proposals to, for one, edit other papers and people who are trying to publish in the same journal as well. So you can help with that process, and I have. And then also, I just speak at different lectures and conferences, and that's an area that I've started to sort of dabble in as I'm honing those skills still. But yeah, definitely it's opened up those opportunities. And in Ontario, actually, the Ontario Ministry is trying to structure, white crowns have never been offered before or covered before by the government health insurance in dental insurance in Ontario. And so they use my study as part of a basis to kind of discuss, the importance of using these crowns and the rigidity and the durability of these crowns beyond aesthetics. So it was very cool to be able to kind of be part of that proposal process, which that opportunity was lended to me through being published in a journal like the Journal of Pediatrics.
Yeah. No, absolutely. And it must be just like this awesome moment because, you get to show your parents and people like that. And I think with anything that comes like that, obviously it's great for you, but it's also great for your family to sort of see like, okay, look, our kids are doing some great things in the community, which is awesome.
Yeah, I caught my mom one day reading my journal.
Yeah. And she's like, I have no idea what most of this means, but it's just awesome seeing it.
Yeah, no, I was like, this is a lot of dental jargon in there, but it's really sweet to see. Yeah.
Yeah, I can't imagine. And given that you've practiced, obviously now you're here in Canada and you've done some practice out in the States, if you can speak to it, are you able to give me some of the similarities or differences between the two systems? And then I guess all things being equal, which country did you have a more enjoyable experience practicing in?
Yeah, so I mean, I guess I'm able to compare associateship in US and Canada the best. And the pay structure is a bit different. So in the US, it's not uncommon to have a sort of per diem pay structure, where you have a daily allowance basically for what you're going to be paid for, regardless of procedures, essentially. Whereas in Canada, it's typically more so a production pay structure. And I'd say generally associates are more content getting reimbursed for their capacity to treat patients. And sometimes that's not possible with per diems when there's a cap, essentially. So I guess that would be a really critical difference to associateship in US versus Canada. As far as kind of preferences, I definitely do prefer to work in Canada. And I think part of that is just because it's really important to connect with your patient pool. And growing up in Canada, there's certain things that would be missed, I would imagine, and working in the States. And just for that aspect of alone, I really appreciate and enjoy working in Canada over potentially working in the States.
Yeah, no, thank you for that. Because I think not a lot of people are actually aware of the differences in the pay structure. And obviously pay structure not only affects you financially, but I think it affects just the quality of care and what your day-to-day life looks like. Because maybe you only have to see a couple patients because you're getting a per diem that's flat versus, being an associateship where the more patients you see, the more people you can help, and obviously the higher your income. So I'm glad that you made that distinction for anyone that might be listening and debating between the two systems. But I guess let's fast forward to today. Where do you work right now? And could you tell me about sort of your day-to-day work at both the clinics that you're at?
Yeah, I work at two different offices, one in Brampton and one in Toronto. And the reason I've kind of chosen to do that too is because you really learn different business models and concepts of treating dentistry, even of course within the same general area. And a typical day is in pediatric dentistry is very unpredictable. Children are unpredictable. So we typically do a sedation in the morning, which is where we will sedate children to be able to complete treatment, particularly for younger kids who aren't maybe yet at the emotional capacity or emotional maturity to be able to sit through, prolonged treatment. And then we'll typically do treatment with a bit of laughing gas, and then older kids in the afternoon. And then in terms of, we typically have many patients who are coming just for routine care, primary care, and our hygienists see those patients. And what's really nice is that over time, you kind of get to see your patients evolve, which is the beauty of pediatric dentistry, is that there's a lot of changes done in these really formative years. And So you get to see patients kind of grow and develop, and maybe weren't cooperative, become cooperative. And that's kind of I guess, the treasure of pediatric dentistry that's really nice. And you get to see it in your day to day. Sometimes even 6 months makes a big difference, right?
Yeah, absolutely. Just even like physical changes of watching their facial structure change, them getting taller, all these things. And yeah, it makes you realize how fast time goes, I bet.
Yeah, for
You're
sure.
probably very aware of that, of like, oh, 6 months ago you were this big and now you're like way bigger and you're like, oh man, 6 months goes by pretty quick.
Yeah, for sure. No, it's really cool. Yeah, it is pretty cool thing.
And given that you've been practicing, it's been about 5 years now, correct?
Yeah, 4. Yeah.
Yeah. What would you say is, let's say, maybe the best part of the job? What do you enjoy the most? And inevitably, everyone has parts of their job that they don't like. So, what would you say is one of the areas that you're like, I don't really like doing this, but part of the gig?
I'd say one of the best aspects of dentistry, or pediatric dentistry specifically, is particularly treating children with special needs who have sort of behavioral limitations. And, for instance, we see a lot of children with autism, and dentistry or a pediatric dental visit is a lot of sensory overload, right? The lights, the sitting in the chair, the noises, the sounds, the feelings, there's a lot of tactile. And so it's really been nice, I think, in pediatric dentistry particularly, to learn how to break down and desensitize to every single aspect of the appointment. And sometimes it can take 6 months or a year, or even 2 years, 3 years, it can take a long time for a child to be able to sit for a routine clinic or take an x-ray. And so I think that's really, really a heartwarming aspect of the job, is being able to see that. And then just to see how families kind of grow and develop around that too. And it's really the most beautiful aspect, I'd say, of pediatric dentistry.
That family aspect, watching them grow, seeing the progress, I guess, in those kids as well, and the impact that you get to have on their lives. Absolutely.
Yeah, definitely.
Yeah. I guess, given all the education that you've done, what would you say is maybe one thing that you just weren't prepared for when you started practicing, from, being in residency, doing your associateship, to now where you are? What was sort of the biggest shocker, or something that you just weren't prepared for that you had to learn while you started working?
I'd say that the communicative aspects of dentistry have been the most challenging and sort of the biggest learning curve. I also feel that school can only teach you so much, like clinically and didactically, in the few years that they have you for. And sometimes certain things just have to be kind of learnt on the job. But definitely, conflict management with parents and staff, and that aspect of dentistry is by far the most challenging, and you're never really prepared for it, and it's changing every day, and you're going to be thrown in different scenarios that you never have before. And so I'd say that that's kind of the part that I was maybe least prepared for, and also I'm still learning and honing those skills.
Yeah, no, absolutely. I think it's something that you'll forever be working on. You meet people who are 50 or 60 years old, and they've been practicing for, as long as you've been alive. And even they're like, I'm learning every single day. There's something that's always new that's happening.
Yeah, definitely, for sure. And people are evolving over time too. So the type of parents have evolved over time, right? So in pediatric dentistry, our biggest challenge is working with parents, right? And so sometimes the fears that we need to dispel the fears of the parents more than the child, right? And so, the type of parenting has changed to, more sort of like, we always hear about like the helicopter parent.
Yeah.
Right? So there's a lot more of that nowadays. And so, it's the whole process of pediatric dentistry is a lot more TLC than maybe it was even 10 years ago, 10, 20 years, of course, but even in recent years, it's evolved a lot.
Yeah. And I could imagine that would be probably one of the toughest parts that is unique to pediatric dentistry, because with everyone else, the patient is an adult, they're consenting, you can have a conversation directly with them. But now you're speaking to a parent. And I would, again, correct me if I'm wrong here, is I feel like parents are much more aware or insecure or worried about their kids than they would be for anything to do with their own oral health.
Oh, definitely. Yeah, I'd say by far, right? It's a very sensitive area, right? For parents. And so it's, you have to approach the conversation very carefully, any conversation that it's going to be, and really kind of understand. And that's an aspect of pediatric dentistry that is, I'd say, super critical, is to understand from a parent's perspective. I'm not a parent myself, but, you can imagine that, there's naturally going to be fears, there's naturally going to be questions, and you really have to kind of dispel your ego and just know that, your job is to really take care of the patient, which in pediatrics is the patient plus mom or dad or whoever. So yeah, it's really important to put them first and to understand, to take it from their perspective, right? And understand that it's scary for parents. Yeah.
Yeah, absolutely. Especially when, a kid can be in pain or whatever the case is. I guess I have three sort of standard questions that I ask all the guests.
Yeah.
The first one is, I'll say I might be actually changing this in the future, but because it is a tough question, but who would you say your biggest inspiration is? And again, this could be lots of people, it could be one person, but who comes to the forefront of your mind when you think of that?
So I'd say personally, it would be my mom or my dad or my sister. And in the sense that their really bountiful love and support has allowed me to continue to pursue my passions. And they've gotten me through the tough times. And if I feel capable, I feel capable of really anything because they've gotten me through there and I know I have them in the corner. So you feel that you're able to do anything because I know I have them in my corner. So I'd say personally, they're my strongest, inspirations. And then professionally, I would say it's the women in dentistry who have really mentored me along the way, from my professors in residency to the women that I work with now who are, managing being moms and work and business and personal life. And I really look to them as a kind of a peek into what I hope for my future. And it's really, I guess, the strongest inspiration I have professionally because it is, women who it's a situation that I will fall into, right? And it's very, very relevant. And those would be my strongest inspirations.
I love that. Yeah, especially with the parents, is when you do have that foundation at home and it's loving and it's caring and they're supporting, you really do feel like, yeah, I could do anything because I have that home base that I could always go back to if I ever need to. And I also love that you have these mentors, especially women in dentistry, who are so supportive because that is very hard to find. It's women do have a different plight when it comes to dentistry or honestly any profession of, we're in that age now where you're balancing work and home life, potential children. It's a lot. Like, this is not a comparison, but I have two dogs and that alone is like takes up all of my time. I was like, and whenever I meet clients with kids, I'm like, how do you get anything done? Like anything at all? Because I can lock my dog in a cage. You can't do that with a 5-year-old. Like, how do you get anything done? Right. So it's awesome that you have someone who's just, like one or two stages above you or ahead of you within your career. Cause I find that your mentors or inspirations, they don't have to be someone who's 50 years older or 40 years older. Having someone who's just like 10 years older who's on to that next stage of life is so helpful. So I'm so glad you have that.
Yeah, no, I'm very fortunate.
Yeah. I guess what's next for you personally as Ashley, and professionally as Dr. Gill?
I'd say personally, I've really been consciously prioritizing health and wellness, whether it's like fitness or reading and listening to health related literature. And that's really been a priority for me personally to kind of grow in that area, and achieve more sort of a healthy work-life balance in the sense of, really making sure that you have that time and that peace, within all of the chaos that's going on constantly with a busy career and a busy personal life. And so I'd say that I'm learning the skills for that. So the health and wellness field has been sort of the biggest kind of area that I've been exploring the most recently in terms of personal growth. Professionally, I've really been exploring more into airway related focused dentistry, and understanding, especially from pediatrics, it's a huge area, especially recently in sort of a more contemporary dentistry in terms of understanding specifically pediatric airways and what implications it can have if diagnosis and then treatment is not accomplished early enough. And so, and we have a unique ability to be able to see newborns and all of that. And so it's really a newer area that I'm exploring more about. And I'd say professionally, that's kind of my biggest driver motivation right now is to learn and expand skills in that area specifically, and just to kind of learn those skills and know how to apply those skills in the recent years.
Love that. And is that new to the field? Because I feel like you're one of the only people I know who's really just honing in on that, or at least trying to learn more and more about it.
Yeah, I'd say it's developed more in recent years for sure, and it's coming up more to the forefront. Before, airway related dentistry was a concept that kind of seemed a bit far out, and now it's becoming more sort of relevant, and we're really understanding more sort of the science about it. Also, as more literature is coming up too, we're learning more and more about it. So I'd say it's becoming more common, but definitely in the pediatric dental field specifically, far more applicable and relevant these years.
Yeah, no, I love that. And I guess because it is the Dollars and Doctor show, if you're comfortable with sharing, what would you say is the worst financial mistake you've ever made so far? And then on the flip side, what would you say is maybe the best financial decision that you've made so far?
I'd say probably my worst financial decision that I've made is not incorporating immediately and investing as soon as I began to practice. I think I waited for too long, and I feel that the benefits of incorporation are imminent immediately. And I wish I had done that sooner, as well as again investing even when the cash flow was lower. And it would have really been, I think, helpful right now. And even just to develop those concepts, even from a learning perspective, would have been really nice.
Yeah. And then what would you say is the best financial decision you've made so far?
I'd say becoming comfortable with asking questions. Nowadays, really with social media, there's the ability to connect with people and with shared values and interests, and that kind of helps with developing a comfort to ask questions in a space that you know really little about. So for me, it was working with you and developing a really good financial plan going forward, and that's really been a really good to develop that structure to have a plan for the future. And it's something that it's an area I don't know a lot about. And so I think understanding, being naive and asking the questions, and you have to be really comfortable to ask those questions, and, finding a space where you feel comfortable to ask questions is really important. And yeah, I'd say that's my best financial decision.
No, I'm glad. And because, yeah, it's nowadays it's a bit of a double-edged sword with social media. There's also so much information out there that's good, but there's equally so much information that's out there that's bad or just not applicable. I can't tell you how many times I get sent a TikTok of something from a client and they're like, hey, does this apply to me? I'm like, no, unfortunately, that's just in the States, or, it works well for someone else. So there's a lot of stuff that's misinformation, but it's also a blessing because, yeah, I can't tell you how many people I've met just online. Maybe they'll ask me a simple question and they're like, oh, this is great. I'm so glad I could ask this to someone without, having to book a meeting or something like that. Just a simple Instagram DM could help solve a lot of questions. So yeah, thank you for that. And I guess to conclude the episode, do you have any advice to your fellow doctors? Let's say regardless of what discipline they're in, whether they're physician or optometrist or in dentistry like yourself, any sort of words of wisdom or advice to your fellow colleagues?
I'd say it's nice. And I mean, I think everyone in this field is quite goal driven. But I feel that sometimes it's almost to a fault. And I think it's important to make long-term goals, and we're all doing that, but really just focus on the day by day, and just makes the process more enjoyable if the tasks are manageable. And you can kind of avoid that position or exhaustion and stress that way too, just by making a more balanced approach to developing or achieving those goals. And I think for me too, I mean, what I've learned and what I would suggest to all of my fellow colleagues is reflection. It's especially critical in times of failure. We're all, striving for excellence, and it's important to reflect and understand that, there are times that we're going to miss the mark, and reflecting on, what happened and how to improve, and accepting that healthy level of criticism, because that's where you grow. And I think that it's really, to develop into a stronger physician or dentist or whatever it is, you really need to be able to accept that criticism and reflect on your own personal failures. And I'd say also, kind of on that note, just enjoying the journey, because these are really great years when you're developing your career, and you can really just enjoy the process, and it just makes it that much more of a drive and motivation to continue to develop your personal and professional life. And, yeah.
Yeah, I really like that response, because the enjoying the journey is something, again, I'm learning. I feel like everyone's learning that. It's so easy to be like, okay, well, next year I'm going to do this, and then the year after that I'm going to do this, and start planning out the next decade of your life. Whereas you just forget to enjoy the days you have right now. And I heard it from one of my mentors, and I've also seen videos on like Instagram about this. And one of my mentors, he's like 80 years old, and obviously a lot older than me. And he was telling me and he's obviously extremely successful. And he's like, I'd give everything to be your age again, everything I could possibly give. And so he's always said that is just try to enjoy, because the time's going to pass. If you do all the right things, you'll almost guaranteed to be successful, especially like with my clients. When I speak to them, it's you're working in a profession where you will be financially fine. At least just enjoy the time while you have it. But also the second thing that you said, which is perfectionism, I feel like the medical space as a whole is much more. There's more people who are perfectionists in medicine and in healthcare compared to other fields. Maybe engineering would be similar. But it's really hard to not be a perfectionist in your field. You're going to make mistakes, and unfortunately your mistakes are going to cause some people some pain and issues, and it's really hard to get over that. How have you gotten over that, or how are you getting better at something like that, where not being afraid to make mistakes, or not being afraid to, it doesn't have to be perfect? How's that something that you've gotten over?
Yeah, I think I've really learned how to be humble and accept my mistakes and then discuss with colleagues, and I think that sometimes we try to hide our failures because we're embarrassed to talk about it with our colleagues. And it's
Mhm.
because we're held to such a high standard of care. And so you feel uncomfortable sometimes having those discussions. But I think for me, I really learned it from my mentors actually, who have been practicing for maybe 5 or 10 years longer than I have. And, they have maybe a clinical failure or, communication with a parent that didn't go well and asking me questions. And I really learned, that sense of being humble. And now I have a really comfortable space where I'm able to speak with my fellow colleagues, or for me, with pediatric dentists, who I feel really confident. I can ask a question and I know, this wasn't my greatest moment. And then being able to actually learn from it. And so it's all about having, I think, that support system around you in a space that you feel really comfortable in.
Yeah, I would agree, because dropping the ego, but I find, the harder part is having that communication with parents. If I made a mistake, or seeing that patient or child in pain, and you're like, oh, I caused that, or whatever the
Yeah.
case is. But I think it's one of those things where you just mentally have to get over it and realize you're not, perfect. There's going to be mistakes, and because of those mistakes, you'll be that much better for the next patient that comes in.
Yeah, definitely. Yeah. And I think that, having the support system around that is really critical to
Yeah.
be able to learn from that and to be able to ask those questions and to be humble, and to accept your failures and own them.
Yeah, absolutely. Well, I think that's like the perfect note to wrap it up. Thank you so much for taking the time to do this. I know I've wanted to do this for a while, so I appreciate you taking the time. I appreciate you coming on, and it's been great chatting with you.
Awesome. My pleasure. Thank you so much.
No, absolutely. My pleasure. Thank you for listening to another episode of the Dental Journeys podcast, proudly sponsored by Whitecoat Financial. Join us next time as we continue to explore the journeys, strategies, and successes of dental professionals across Canada.